Um, thank you. To begin, I would like to pay my highest respect to His Excellency Dr. Red Barom, also all the judges and all the attendees. Well, I am Yin Dasa and I'm here to present a speech about a condition called as skin cancer. And before we start our topic, I would like you to know what skin cancer is first. So, skin cancer refers to, according to WHO, it is a common type of cancer that arises from your skin. It's the abnormal growth of uncontrollable growth of abnormal skin cells, and today we'll be discussing the 3 most common types of skin cancer that exist. So let me present this to you. Being the first one that I'm going to talk about is basal cell carcinoma, the most common type of skin cancer, and this part I'm going to tell you about where each type of the condition often appear on your skin and how to identify it. So basal cell carcinoma often appear on the sun-exposed areas like the head, the face, the neck, the ears, and so on. And how we want to identify it is like when you notice there is like a pearly, waxy bump, like a scar or lesion that appear on your skin, or a scab that appear on your skin that heals and then return, and it appear for no reason, and that is the sign of basal cell carcinoma, or we can call it as BCC. The second type of skin cancer I'm going to talk about is squamous cell carcinoma. This condition, similar to BCC, squamous cell carcinoma also often found to be appearing on the areas that are often sun exposed, like but sometimes it can appear inside the mouth, the anus, and the genital areas too. And how we want to identify this condition is like when you notice there is a red bump, a red scaly patch, or a lesion, flat lesion that with a scaly and crusted surface that appear on your skin for no reason, that is the sign of squamous cell carcinoma, or SCC. Though we consider these 2 conditions as a non-life-threatening condition, but if it were to be left untreated for an excessive amount of time, then these 2 conditions can develop themselves into serious condition, which can cause complication and even leads to a person's demise. And trust me, there's no such thing as a harmless cancer. And being the last one, the third one I'm going to talk about is melanoma, the most dangerous form of skin cancer of all. And this condition often found on sun-exposed areas, just like the other 2 do. And it can appear anywhere inside your body. And the appearance of it is like a mole-like bump, or a mole-like lesion, or a mole-like spot, or something like that. And how we want to identify this condition is like when you notice there is we need to follow the rule, the ABCDE rule of melanoma, in order to identify this condition, in which the A stands for asymmetry. It's when one half of the mole or the spot that appear on your body does not match with the other half. And B is border. Mostly melanoma appear on your skin with irregular shape. So the border of melanoma often irregular, notched, ragged, or blurred. And C is color. So sometimes melanoma can appear in more than one color, can consist of more than one color. This is when the color of the spot or the mole on your body is not uniform. It can be a mix with brown, black, pink, red, or white, or blue, and like that. And that is the sign of melanoma. And the letter D is diameter. Melanoma often appear to be larger than 6 millimeter, but however, it can appear smaller when early detected. And E is the abbreviation of the word evolving. This is when the mole or the spot on your body is changing in size, in shape, in the color, and that is how we notice that it is a melanoma. And if you notice there are such spots on your body, rush to your dermatologist to get yourself checked out. And if you were to have one of the conditions that are mentioned about, then you should get yourself treated early, because early detection of skin cancer can lead to a successful treatment. And now that we know the appearances of skin cancer already, the majority of risk factor that causes this condition are like when you have history of sunburn, when you have fair skin, when you like genetic can also be a role in the cause of melanoma too, and it can be due to your age, it can be because of your immune system is weakened. This is due to you having AIDS or you're taking immunosuppressant pills. That's how you're, by doing that, you are increasing the risk of developing skin cancer. And the most common reason of that have skin cancer appearing on your skin is excessively staying in the sunlight, like you're like got exposed to the sunlight excessively. And getting exposed to the sunlight excessively can cause you skin cancer, but I don't mean that you have to remain in the shadow like Batman does, or you have to avoid the sunlight at all costs like a vampire. But what I mean is like you can enjoy your life under the sunlight all you want, as long as it's not between the hour of 10 a.m. to 4 p.m. because during this hour, the UV radiation at this hour are significantly strong. And remember to wear sunscreen with SPF 30 or higher, because you don't want to wear any sunscreen that have SPF below that. It's not going to do anything. It's not going to protect you or anything. And some of you might think that reapplying sunscreen every 2 hours can be frustrating and annoying. This is when wearing protective clothing come to play. So what you want to wear is long sleeve shirt or long sleeve pant or wide brim hat when you are traveling under the sunlight by walking or something like that, or you're working under the sunlight. Before, according to some people perspective in Cambodia, in our country, they prefer people to have pale skin, which require them to apply whitening lotion on their body, which is not, sometimes it can be harmful, because before you applying any of those whitening lotion on your body, please do know the ingredient of those products that you are using, like the back of your hands, because sometimes it can contain harmful chemical substances that can cause skin cancer. And just be careful with that, and do your self-skin check out every day, like regularly, because sometimes you can spot or notice a spot or a mole that are irregular or look suspicious to you, and you can rush to your dermatologist in time and get yourself treated in time. As I mentioned, early detection of skin cancer can lead to a successful treatment. And to sum up, my point in this speech is to raise your awareness of skin cancer, as it is common. It's normally happen when you're walking under the sun, and it's the thing that we do in our everyday life, and have you taking care of yourself better. That's all I have for my speech. Thank you for your attention.
So everybody in this hall loves eating food, right? I also love eating food by the judge of my look, and food is an important part of our life. We need food to survive. But have you ever eaten something and you feel uncomfortable and need to go to the restroom? You can be diagnosed with food intolerance or food allergy. So how do you know which one is which? Before I get into that, I would like to pay my highest respect to His Excellency Dr. Neboram, the Vice President of International University, and Mr. Kanchan Thuan, the Head Department of English. My name is Song Tai Fong, a medical student majoring in medicine and pediatrics. I feel super honored to be given another chance to talk about my topic, which is about food intolerance versus food allergy. So in order to distinguish two things, you need to have a clear understanding of those two things. So firstly, food intolerance. Food intolerance is a condition where your digestive system doesn't produce enough enzyme to break down the food. So when you eat something, it goes into two processes of breaking down. The first process is mastication, is when you chew your food with your teeth, and the second process is by breaking down chemically. After you chew your food, you swallow into your esophagus, that goes into your stomach and the intestine. That's when the problems happen. When you're intolerant to a certain type of food, your body doesn't produce enough of that enzyme to break down that certain type of food. So, for example, if you have lactose intolerance, some of you have probably heard about this one, your body doesn't produce enough of the enzyme to break down the molecule of lactose, a type of carbohydrate. So moving on into food allergy. Food allergy is the abnormality of your immune system to food. So as you may know, your immune system is there to protect us. So for example, if you have bacterial infection, your immune system will rush and combat the bacteria. But in this case, due to genetic, your body will think that the food is an antigen, the enemy. So as comparison, instead of scoring a goal in a football team, into the other team, you score your own goal in that case. So when your body thinks that a certain type of food is antigen, it will start producing IgE. IgE is immunoglobulin E, and it will bind into the antigen and start releasing histamine. So what is histamine? Histamine is an anti-inflammatory agent that can produce symptoms such as bronchi-constricting that leads to difficulty in breathing, also vasodilation that leads to swelling, and low blood pressure that also leads to anaphylactic shock. In comparison, the symptom of food intolerance is not as threatening as food allergy. The symptom of food intolerance only cause bloating, headache, irritation, and inflammatory. So what about treatment? So as for now, there is no treatment to food intolerance or food allergy. The best way to go around both conditions is to avoid the known allergic food that you have or the food that you can't tolerate. To sum up, food intolerance is something that is to do with your digestive system, where food allergy is something to do with your immune system. It's important to distinguish both conditions, and the only thing that they have in common is that they are due to genetic and can't be treated. And finally, I would like to advise everyone to listen to your body. If your body rejects it, you should avoid a certain type of food and stay healthy. Thank you.
Hello. So first of all, I would like to pay my high respect to His Excellency Nate Barom and judges, teachers, and all participants here. My name is T. Sochovi, the first year student from FY12 class, and also a faculty of pharmacy at IU University. So for today's speaking competition, I'm really excited that I'm standing here on this marvelous stage and share my idea, also my education to all of you guys with one interesting topic. And my interesting topic is about stomach disease. It is one of the common topics all around the world. So for today, I have 3 main points related to stomach disease, related to this topic. But before I start my topic, I would like to ask all you guys here, have you guys ever heard or you think that you have stomach disease? Please raise your hand. Okay, thank you so much. So, there are many reasons that people have stomach disease. And why? And what is it? You know, stomach disease is a kind of disease that affects to our digestion. And do you know that why we have stomach disease? And there are many reasons, and also there are many people around the world that have stomach disease. You know, sometimes it can cause because of our food or what we drink or some activity that we do and we don't know that it can cause to stomach disease. So for today competition, I will divide it to 3 points. What is stomach disease and why we have stomach disease? And the last point, if we have stomach disease, what can we do to get better from the disease? So for the first point, what is stomach disease and why we have stomach disease? You know, stomach disease is a kind of disease that can really affect to our body. When we eat the food and the food is not good, so it really affects to the way that our digestion. And why we have stomach disease? So for the first reason, it's because of our food. Ladies and gentlemen, before I tell you the reason why it causes to stomach disease, I want to ask all you guys a question. Have you guys ever eat papaya salad? Oh, no, it's not loud at all. So let me ask you in Khmer. Have you guys ever eat bok lahong in Khmer? Yes, it's one of the common food in Cambodia that people really like to do, like to eat, like to buy it to eat, morning, afternoon, evening, at night. You know what? Because it's yummy. Even they know that it's not good for their health, but they still like to eat because they think like, now I'm still alive. So why I don't eat whatever that I want? What happens if I die tomorrow? So why do I have to care? Just eat. Okay. I don't have to care a lot. I don't have to think a lot. Think a lot becomes stress. Well, I don't want to stress. I want my life to become ping like me. Okay. So, but you know, what you think are wrong. It's really affect to our body. Not only our stomach or not only affect stomach disease, but their bok lahong in Khmer or papaya in English, it really affect to our health. And I have one more reason, but there are 2 drinks that most people around the world like to drink, including young people, adult, and old people. So let's start with the first drink. Let me ask you guys one more question, ladies and gentlemen. Have you guys do you guys like to drink coffee? Can you guys answer a little bit louder? Do you guys like to drink coffee? I do. I like to drink coffee. Without coffee, I become crazy. My brain is not working at all. In the morning, when I don't drink coffee, my brain is not working. So I want to drink coffee. And I can't stop myself from drinking coffee. Because without coffee, my brain is not working at all. But you know, coffee can really affect to our health, especially our stomach. Some people, you know, when they are really addicted to coffee, they don't eat breakfast. Their breakfast is coffee. And I think people are here like to drink coffee, including I. And one more drink that most people like to drink, not only Cambodian, but around the world. You know what is it? It's called beer. Or in Khmer, what they call in Khmer, chia chia. Yes. You know what? People nowadays, when they are really addicted to beer, in the morning they think of beer, in the afternoon they think of beer, in the evening they think of beer. Some people drink beer all day, all night because they really love to drink it. You know, when they finish their work in the evening, they call their friend, hello Nop, chia chia. Okay. And you know, chia chia, that chia chia really affects to our health. It also affects to our stomach as well. Nowadays, not only old people that drink beer, you know, young people, including I also used to drink beer. I want to know how it tastes. It really affect to my life or not? I just drink one glass, and you know, sometimes people, because of they want to try again and again, and become affected. And when they affected to bốc lahong or be affected to beer or coffee, you know, those reasons become stomach disease. You know, it can cause stomach disease. One more thing. People nowadays, some people are affected to work. They work non-stop. They think that, I have to finish my work and then I can eat lunch. But they forget to take care of their health. You know, you have to eat properly, eat regularly. It's okay to find money. It's okay to finish your work. You have to prepare your time perfectly. And don't forget to eat right, regularly. You know, when you don't eat regularly, it can affect to your health. You know, it really affected and give you a lot of disadvantages. When you are sick, you not only waste money, but waste time. You waste money for what? Waste money to stay at the hospital because you are sick. And you know, you also waste your time. Your time to do other work, to do important work, and also lost happiness in your family. You know, when you are sick, for example, when my mother is sick, am I happy? No. When your mother is sick and you're happy? No. You are not happy with this. You want to see your family healthy. That's why, you know, when you are sick, you lost both, lost many important happiness, also lost time and waste money as well. So if you don't want to waste money, why you try to drink beer or try to eat papaya salad? You already know. I think people are here already know that it really affects to your life. But why you still do it? You know, you are what you eat. You know that when you eat, it affected to your body, it affected to your stomach, and some food, it really affected to other things on your body. So why do you still eat? You know, and the last reason, also the last point that I want to tell all you guys, if you have stomach disease, what should you do? So for the first reason, from yourself, change your bad habit. You already know that the food that you eat is not good. So why you eat? You already know that jek is not good. So why you drink? So stop doing it. If you want to be healthy, you want to live longer, think again. And for the second point, I would like to tell all you guys to meet a doctor and check up your health. Why do we have to check up our health? Some people, they think like, I don't want to spend money to check up my health. I'm strong. I'm still cute. Why do I have to check my health? I'm not sick at all. No. We just check our health to make sure that we are sick or not. We outside, we don't know that we are sick or not. But inside, you know, that is why we have to meet a doctor to check up our health. And we just spend less money. But when you are sick, you spend more money, more time. It's such a waste of time and money as well. And that's all for my speaking competition. And thank you so much for spending your time listening to my speech. Thank you.
Thank you, handsome MC. Before I start, I want everyone to imagine one scenario. Everyone here can close your eyes or keep it open. Imagine waking up. It's a normal day. It's rainy or it's sunny. It's good. You feel good. You feel rested. You took a shower. Everything is fine. You have your normal breakfast. But then suddenly something happened. You feel this really sharp pain in your chest. You feel like there's something pressing against it. Something is grasping it really hard. You feel as though there's an elephant directly on your heart. And then the next you know it, you're being rushed to the hospital and you found out it's a heart attack. So what is a heart attack? To start things off, I want to say good morning to everyone, especially to His Excellency Professor Ned Barom and Mr. Kanchanthun, the head of the English department. Esteemed judges, faculties and staff, fellow contestants, students and guests, My name is Chiumuntray, and I'm a medical student from the Faculty of Medicine and Pediatrics. Today, I want to talk about cardiovascular diseases. There are a lot, but the most common cause of cardiovascular disease is called CAD, coronary artery disease. In today's speech, I will break it down into 3 parts. The definition of CAD, so what it is, its pathophysiology, how does the disease come to be what it is, and lastly, treatment and prognosis, what can be done about it. So firstly, CAD, coronary artery disease, is a disease affecting your blood vessel that surrounds the heart, also known as coronary artery. It is characterized by a buildup of plaque inside of your artery. And so you have symptoms of chest pain, you sweat a lot, and it's really uncomfortable to live, or when you have a sudden attack. A lot of people suffer from this disease, especially in Cambodia. About 10% of people who pass away each year is due to coronary artery disease, especially older people. And moving on, its pathophysiology, its disease progression is divided into 4 parts. The first one is injury to your blood vessel. So if you have other chronic disease such as hypertension or diabetes mellitus, it increases your chance of damaging the inner linings of your blood vessels. And when those blood vessels become damaged, it creates a spot that other molecule inside your body could attach to. Secondly, lipid accumulation. Your body has normal cholesterol, but when it gets too much, those cholesterol can get lodged into your blood vessel, especially your artery. And when it gets lodged into your artery, it causes a blockage. When cholesterol is high, your body's immune system sends white blood cells to those cholesterol and destroy it. But it doesn't only destroy those cholesterol, it also destroys the inner lining of your blood vessel, especially your coronary artery. And so there's inflammation going on. And with inflammation, other substances such as more lipids, more fatty substances, calcium, cholesterol, cell debris, waste product of metabolism can get caught up in it. And that's when plaque formation happens. Plaque can be divided into 2, stable and unstable. The difference is that one, you feel like you're having really a lot of pain in your chest when you're doing activity. So let's say you're going to Aeon 2 with your family or with your girlfriend or boyfriend, and you're walking too much, you're walking too far, and then you start getting symptoms of a heart attack. You start feeling pressure in your chest. That's stable angina. But when you take a break, you rest, it stops. This is due to incomplete obstruction of the inner lining of your blood vessels. Another type of plaque is called unstable. This one is more complex. It's bigger, it's larger, and it's ununiform. Its composition ranges from calcium to lipids to cell debris. And the worst part about unstable plaque is that it can easily rupture. Once it ruptured, it can release a lot of blood into your artery. So even though there are blood inside of your arteries, when a plaque ruptured, it releases even more blood. And when that happens, blood clots happen, causing complete obstruction of your coronary artery. So even if you're doing nothing, even if you're just sitting, listening, or even while you're sleeping, it can suddenly become obstructed, and that's when you get a heart attack, a complete blockage of blood flow to the blood that supplies your heart. And so what can be done about this? About treatment, there are 3 main points. First, it's lifestyle changes. Second, it's medication. And third, it's about surgery. Firstly, lifestyle changes. People who are at risk of developing heart disease are recommended to do regular exercise, because by doing regular exercise like walking, cycling, or even swimming, you reduces the amount of cholesterol in your body. Secondly, it's diet. Try to eat more food that are healthy, such as fruits, vegetables, lean protein, and meats that are good. Avoid saturated fats or trans fat, because those increase the risk of cholesterol in your body. As people get older, their bodies start to slow down. Whether you like it or not, that's the norm. That's the normality of it. And when your body slows down, the waste products aren't being excreted out properly. Cholesterol builds up, uric acid builds up, and other metabolites builds up. And these are all risk factors for developing cardiovascular disease. Thirdly, try to maintain an active lifestyle. Sleep well, eat well, do regular checks up. Because when you check up a lot of your health as you get older, your risks of developing a heart attack also decrease. Secondly, let's talk about medication. What if you manage your lifestyle, but it doesn't work? You still have symptoms of chest pain, you still have symptoms of heart attack. So there are medications that can be used. For instance, statin, a group of medication used to lower your cholesterol levels, can be used to prevent formation of coronary artery disease. Secondly, you could also use calcium channel blocker or ACE inhibitor. These medications are used to lower your blood pressure, so there's not much injury to your blood vessel. And the golden standard for treating a heart attack is nitroglycerin. It's this magical pill that you place under your tongue when you're having when you're having symptoms of a heart attack. Its action is making your blood vessels large. So even if there's an obstruction, when it gets large, blood flow can flow beautifully and correctly to your heart. So you lose some of the symptom of a heart attack. And lastly, the most definitive treatment for coronary artery disease is surgery. There's two main parts of surgery. You could do stenting. It's where people insert metal mesh inside of your artery to dilate it permanently so that it doesn't get obstructed anymore. And another one is called a CABG procedure, CABG, coronary artery bypass grafting. It's where a surgeon harvests a healthy blood vessel from other part of your body and place it into your heart so that there's new blood flow supplying the muscle of the heart. Talking about prognosis, for mild to moderate coronary artery disease, managing lifestyle changes and medications are the first line treatment to fix some of the disease and hopefully treat it. But for more severe cases of coronary artery disease, surgery is the only definitive treatment. People who are at risk, especially people who are 40 years old and above, should do a regular checkup of their health and their heart health, because heart is one, if not the most important organ in the human body. And without a working heart, your life won't be as good and your life won't be as long. So in conclusion, I would like to say thank you everyone for your attention and really hope that by being here today, you understand a bit about what disease can affect your heart, what it is, how does it progress, and what can be done about it. Because by being knowledgeable in these things and understanding the what, the why, you are increasing your chance of preventing it, especially for yourself and also your loved one in the future. Thank you very much. Thank you, everyone.
Okay. And the 8th spot is presented to Mr. Sok Rothanet from the Faculty of Medicine and Veterinary. Alright. Nervous? Okay. From the 7th pick, please bring your baby up on stage. Miss Chu Ariana from the Faculty of Pharmacy. Thank you. For the 6th spot, presenting about the disease of the skin, please welcome Mr. Yin Dehan from the Faculty of Medicine and Pediatry. Moving to the 5th spot. Can you guess? Everyone? Okay. The 5th spot is presented to the first presenter, Kim Na Tito from the Faculty of Medicine and Pediatry. Congratulations. I see someone getting nervous right now, and I don't know. My friend's also getting nervous, which he will go up on stage on the 4th pick. Please congratulations to Chia Mundrai from the
the Faculty of Medicine and Pediatrics. Alright, now for the top 3. Presenting on 3rd place, he wants to redeem the cash prize he lost from last year. Wait, please, congratulations to Tolsien Hai Lee Seihok from the Faculty of Humanities and Languages. 2 more. From the 2nd place, I think it's one of the most favorite topic. Yeah. Please welcome Miss T. Sochowi from the Faculty of Pharmacy. Congratulations. For the 1st place, he gave you all the reason to go to the hospital and is doing a health circle. Please congratulations to Chirut Vijay from the Faculty of Medicine Pediatrics. That is all for the losers of today's contest. Please don't be let down. You are doing great. You're perfect. Thank you for your bravery. And for the 9th contestant, congratulations. And your prize reward is waiting for you in the 3rd round. Thank you.